As you begin your virtual skilled nursing facility, you've picked out a population that you are planning to serve in your virtual world. Hopefully you've thought about the patient as a real patient and not just one on paper, or several on paper, because you're not taking care of just one patient. You may be taking care of 50 or 100 or 300 patients, depending on the population that you chose. So in week 3 and 4, we're going to be looking at the building, the process of getting a skilled nursing facility organized. And as you can see from your homework assignments, I could have made you define everything, but that would have been an entire 12 weeks of definition. Building a building, looking at architectural design, worrying about where the supply closets are and the call buttons and the lawn sprinklers and the firewalls and whatnot is a lot of things to look at, which of course is why you would hire the appropriate people to help you do this. But I want to take you through some thoughts about buildings that I've been in over the years that make or break a facility and or the staff. Now, buildings. I would like you to look around your own hometown, where you are, no matter where you are, and see what kind of long-term care skilled nursing facilities that you have in your vicinity. At least one will be a hospital, and most hospitals are multi-storied, elevator, large expansive areas, inside surgical suites that don't have windows to cut down on infections and dirt and whatnot. Long halls, central nursing stations. Then you can look around and see your more typical nursing homes for the elderly or the chronically ill or injured young people. And these are often, if not exclusively, I can't think of one that I've ever seen that was multi-storied other than the VA. They're usually all ground level, large kind of ranch-style setups, and that's probably what you're going to end up with too as you look at things. Now, there's a rationale for that if you really think about it. Why do we not make long-term skilled care nursing facilities multi-level? Well, moving hospital beds to and from an elevator, or even wheelchairs to and from an elevator, is actually quite a bit of work and takes more than one person most of the time. So there's one good reason right off the bat. Another good reason is patience. There's a joke in The House of God, which is a book from the 1970s, that talks about Mrs. Smith falling off the 9th floor and the building only has an 8th floor. What they're referring to is hospital beds that are high, too high, and when she fell, she broke her hip or broke her head or whatever, and it's kind of an inside joke that people fall. Well, people do fall, and while it was an inside joke to that book, it's not for us. How you build your facility will have a lot to do with whether or not people fall or get lost or can get outside and get lost. You don't really need an Alzheimer's unit to have a lot of outdoor exits that a patient is likely to go through, because then you're going to lose the patient. So as you're starting to look at how you want to build your building, look around your town, see what kind of nursing facilities there are, see where they're built. You may want to put your building on a lovely site in your town. You can see it, you drive by it every day, and there's a lovely forest and a little creek running by it, and there's a hill. But you might want to reconsider that, because hills mean steps. Steps and wheelchairs and hospital beds don't go together overly well, so you'll need ramping or elevators. A forest and Alzheimer's patients, probably not a good idea. A river that patients can roll into, walk into, fall into, probably also not the best idea, not to mention they're a flooding source of your nice new building. So look about your town, decide where you're going to put your building, what kind of building. There's some ideas in the book about that. And then think about, how do you want to really lay the puppy out? The most common, of course, is a central nursing core, where the nursing team can fan out to the 4 corridors. Well, 4 corridors or 3 is not bad, especially if they have line of sight. So if you know somebody's gotten out of bed or whatever, you can see them if you happen to be pointing in that direction. But when it gets interesting is when you have the multi-unit facilities, where you have corridor after corridor after corridor of central nursing centers that you can literally see from the front door, but the patient has no idea how to get to or from. They generally do not know how to find their room if they're in the least bit confused. If you really think about it, most visitors don't either. We tend, if you go look at your places, to mark things for only the staff, and so we call it corridor A, and we call it wing 1, and we call it closet 15. But that means nothing to the people that you're serving in those buildings. So think about how you're going to lay it out, and whether or not you're going to call it corridor A, B, C, and hallway 1, 2, 3, and door 15. Also, think about, where do you want your logistics stuff to be, your supplies? How far do you want your nursing staff, food staff, social worker, doctors, etc. to have to walk to get everyday supplies like fresh sheets and the little blue chucks that you put under patients to create a moisture barrier? Where do you want all that stuff? Where do you want your pharmacy room? How accessible to other people do you want medical records? How do you want your computer set up to where privacy is maintained but is still functional day to day? These are all elements that in week 3 and 4 you need to think about, not just on paper, but how will it affect the persons of your skilled nursing facility and your employees, because an unhappy set of employees will make for an unhappy set of residents or patients. So read your reading, look online, take a tour of something in your own town, and see what would be best for you on paper. Have fun.